is more like a presentation converting into a paper, so I'm sorry for the study. I tried my level best to cover the things. I'm feeling like I'm 12th man and I can imagine the enthusiasm of the crowd, but we have to do this. So transgender, male to female, why they are increasing cases? Because there are more confirmed diagnoses for the gender dysphoria nowadays. There is more awareness and world is more receptive for the gender dysphoria, and there are more legal safety to this community. Now, gender dysphoria, they undergo two types of treatment. It is a reversible and irreversible treatment. What I'm talking right now is two psychiatric evaluation, one hormone therapy. They undergo face, top and bottom surgeries, and then there are multiple ancillary procedures. The hair transplant comes into the ancillary procedures. Now, this is a retrospective observational study of 6 patients of gender dysphoria with a male to female transition. This is a single-centric, single operating surgeon and a team. With the level of evidence is 5, it is my personal observation. The 6 patients were observed for the consultation, planning, execution of the hair transplant by FUE method. My study says consultation, planning and execution. I am yet to see the results. All were 12 months or more post-transition, which is on hormone therapy, and all were post-FFS, which is a facial feminine surgery. And the 2 patients of them were seropositive. The 4 wanted only hairline creation. Out of 2 wanted only scar cover. 1 was hairline and a mid-scalp and a temporal, and 1 was a vertex cover. Now we are looking at this. They undergo major transition from a male-looking face to a female-looking face. In that, the hair transplant is a very much important role. And there's a short video in which I'm going to talk about the consultations that you're looking at today.
Well, I previously had facial feminization surgery, and its left me was a very high hairline.
Okay.
So that's trying to lower the hairline a little bit and maybe bring it around the
This is a
side.
real-time consultation. It's not scripted.
Different hairstyles.
Yeah. And when was your FFS was been done? That was
The FFS was done 2 years ago.
2 years ago.
And then recently I had a little bit extra
Touch-ups.
touch-ups. Yeah.
And that was how many days back?
That was 1 week ago.
Oh wow, oh wow. So you are healing well after that? You are recovering well?
Yes,
Any
recovering.
other problems for the post-recovery time? Nothing.
Oh good.
Yeah. And what about your recovery 2 years before when you had FFS? It was smooth? No
That
problem?
was nice, yeah. Good recovery.
Yeah. Can you tie your hair on the back side?
Sure.
What are we looking at today? What are we looking at today?
So if you see the consultation, all the usual questions of a pre-hair transplant were asked in the transition period, previous surgeries and healing problem. The most important was a recent surgery because the breast implant, if we put a patient in a prone position, there are high chances of a recent breast implant to migrate. Any touch-up or FFS for that being done is a fat grafting because a post-op facial swelling will go on a higher side, and most of these patients are on a chin strap if they undergo any such kind of treatment. So in the transplanted area, we have to just shift the position of the chin strap if needed, and in which medication they are on, and what do they want, hairline, scar cover or a crown. Now in the second video, I'm going to talk about the planning.
We are looking for the changing the male pattern into female pattern. There's a beauty of hair transplant, and in which we are measuring the central line, the lateral end of eyebrow, and the mid line. So basically, there is a concavity. There are 2 triangles on the inside, and we are trying to convert in the convexity. I'll show you how I'm planning.
Okay.
And we are going to put a high density hair transplant in this patch. It will be covered in a span of, I would say, 6 hours. Yeah. And again, open up your, we'll discuss this thing out. Can you see your hairline?
Oh yes, I see.
Yeah. And body size? Yeah, you're happy with the hairline?
See, looks great.
Yeah. So in trans-HT, the most important part is the patient's expectations. Now, since we are going to convert it into a female pattern frontal hairline, There are various female pattern frontal hairline, and every patient has a different expectations as per their look. So there can be different frontal hairline. Of course, this is going to be wavy. It's not going to be straight. You're going to come forward, backward like this. Some of the patients, they want a hairline which goes like this. I think Indians, when I operate on Indian patient, they rather go with this kind of hairline in which the forehead becomes more narrow when we put more hairs here. But as far as whites are concerned, I think they are more happy with this hairline because it's more natural to them.
So I think I don't have time for this. So yeah, the planning, the important points were the discussion with the patient and understand their expectation. Show them the hairline in the mirror, give option of the different hairline they can have, and discuss the angulation, and discuss the scar survival in a transplanted or a scar head survival. There's another video which I'm going to skip.
Most of my patients,
in the positioning, the breast implants and the AHRS as discussed before, and there are a few results which I have covered: the temporals, mid skull, crown, frontal. Now, already 2 sessions been done, mega sessions, and I could do only 340 hair transplant to just look at the scar. This is a post-operative photograph in which she was happy because the scars were covered. 1000 grafts and 420 grafts. So there's a learning curve. I'm too juvenile in the learning curve, as I always say. And the salient features of the transgender ST is the transition time, previous surgery, hairline preference, and positioning the prone patients. And the grafts are of good quality. Lack of beard in a body hair is one of the limitations, and a post-op finasteride is not required. And this group patients are very compliant and more understanding than the general population, and they are very much open in their community about the procedures they undergo. Thank you.
Any questions from the floor, please?
Morning, sir.
I would like to ask, why did you make a widow's peak for the patient in the center, where the hairline just has a small peak? Because that is one of the easy recognizable visible characteristics for a female hairline. You either, if they don't want a pointed peak, you can make it slightly rounded, but having a straight hairline when you're advancing gives more first impression of an artificially created hairline. So if you would, that's my suggestion. If you would have had a rounded curve over here or in the center, you would have a small widow's peak. That takes away the attention that this is an artificially created hairline and is the first character you can recognize as a female.
I'll take that.
Yeah, Vivek, please.
What were the ethical clearance you need to take before attempting on a transgender patient? Any legal, any ethical clearance? Are they mandatory? Have you researched about that?
There are multiple laws which have changed over the period of time, and these laws are mainly for the irreversible procedures which we do. As far as the reversible procedure goes, the 2 psychiatric evaluations are enough. There was one law before in which there was one affidavit was needed by a patient, by a lawyer, through the same local court that they are undergoing the procedure. But then there is one statement which came from the Supreme Court that this is not required. So it's a very grey zone, and we have a society known as the AHRS, which is a kind of an Indian society for the transgender health. And recently we had a discussion on that only 2 psychiatric evaluations are enough for now.
Thank you, Dr. Umang. Next, I invite the next speaker, Dr. Sanobar. She will be presenting on long-term utility of FE in cicatricial alopecia.